Good day, everybody. A warm welcome to the Primary Spine Provider Network Masterclass, Wednesday Lunch and Learn. We trust you've had a good day so far and are holding onto your seatbelts for hopefully a provocative, interesting, enlightening, and career-advancing discussion today. So our speaker for the next 30 minutes is going to be Dr. Marcia Spoto. Dr. Spoto, just a quick introduction to her. She received her PT degree from Damon College in 1979 and her DC degree from Palmer College in 1982. So also holding an orthopedic specialty certification, all giving her a unique perspective on healthcare in general and spine care specifically. From 97 through to 2018, she served as professor in the Department of Physical Therapy of Nazareth College and is currently on faculty at the University of Pittsburgh Primary Spine Practitioner Program. She and her husband own Star Physical Therapy in Fairport, New York. She is a co-author on multiple scientific publications and has made numerous scientific presentations nationally. She's active on committees in the American Physical Therapy Association nationally and in New York State Physical Therapy Association. While at Nazareth College, she received several grants and participated in research. She has served as a consultant to Excellis Blue Cross Blue Shield and to community initiatives about pain management, spine care, and orthopedics. So it is my pleasure to introduce her today. Marcia, over to you.
All right, thank you. Thanks, Dave, for the nice introduction. Can you stop sharing so I can get on to my presentation? I also would like to welcome everyone. I hope your day is going well. So we're on to this topic of physical therapists or chiropractors, who is better suited to serve the role of primary spine practitioner. So a less provocative title might be, what are the strengths and what are some of the barriers that each profession brings to this role? And I'm very pleased to be able to speak to this and address this topic today. I had to really think about this. This is a could potentially be a pretty nuanced discussion. So I decided to approach this, first of all, from three vantage points: the history of each profession, a little bit about the history of each profession, educational considerations, and cultural considerations. My disclaimer coming into this is that, we all know there's a tremendous amount of variation in practice within both professions. So I'm going to be trying to, kind of stick to the 1,000-foot view. I will be making some generalizations, some statements based on my experience, but I hope to certainly separate out my opinions from, factual information. So starting with history, and again, I think we could, certainly, this is a really quick trip down memory lane for the history of each profession, but I've just kind of chosen what I think are milestones. And again, just to create some understanding of the origins of the two different professions. So I'm going to start out with the chiropractic profession. I think, most of you know, if you're a chiropractor, that there was a date and time that chiropractic was founded, and it was in 1895 by D.D. Palmer in Davenport, Iowa. And, some of the backdrop to that, it just didn't happen overnight. There was, he was involved in he was kind of playing around with a lot of alternative medical practices, not the least of which was bone setting. So bone setters were lay manipulators, very prevalent in England, for example, in the 1800s. And also he was interested in magnetic healing. So the idea of energy and energy flow through the body as a healing force. And so these things came together for him, and the chiropractic profession was born. It was considered at the time an alternative healthcare profession. I've really bolded that out because that's going to come back to play a little bit later. So that was its origin as an alternative healthcare profession. And keep in mind that medicine didn't exactly have the best reputation at that time. There was no such thing as evidence-based medicine back then. And we also know that the focus around the profession was this concept of the spinal subluxation. which was initially more or less bone out of place theory, but later it has evolved into this concept of subluxation complex, which is more inclusive in understanding a lot of the physiological aspects of spinal dysfunction. So the early training and education of chiropractors, I'm going to talk about education, but just to bring you up to 1922, it started out with a few months long training and kind of evolved into a little bit more structure. There was no accrediting body until 1922. So that was kind of a milestone for the profession. And that was when the ACA was founded. And so educational standards became, more common. And then another date in time in 1974, when the Council on Chiropractic Education was recognized by the U.S. Education Department as the accrediting body for chiropractic education. So further embedding it into society and recognized as a science. Another pivotal date was 1976. And that was when a group of chiropractors in Illinois brought a lawsuit against the AMA for antitrust. At the time, the AMA had a policy that disallowed its members from consulting with chiropractors. And I really remember this period of time because I was actually in my chiropractic education during the time between when the lawsuit was initiated and its ruling in 1987, which was in favor of chiropractic. And that was subsequently upheld in the Supreme Court. So that was another, I think, moment in time when, you see this gradual movement of chiropractic into more mainstream healthcare. And then another pivotal point I brought up is 1994. And I remember this because I was in practice when the Agency for Healthcare Policy and Research officially endorsed manipulation as an evidence approach to treating spine conditions. So that's our quick trip through the chiropractic profession. Now, physical therapy profession. And I'm certainly acknowledging that if you're a chiropractor, you probably know a lot more about the chiropractic history and vice versa. If you're a physical therapist, you probably know all this or know a lot of this. But, the origins of the PT profession were a little bit more gradual. There wasn't a moment in time necessarily, but in the US, it pretty much started to develop in the early 20th century. And there were two parallel events that really prompted the development of the profession. One was the polio epidemic, and the other was the need to rehabilitate soldiers, particularly surrounding initially World War I. And I'll just make a side comment here. There's always been strong ties between the profession and the military and that carry over today. But really what was the underlying premise was that there was a need for rehabilitation services that previously had not been met. And so just like the chiropractic profession, initially there were just kind of week-long training for physical therapists. The early physical therapists were physical educators and nurses primarily. They went through this specialized training, and there was no license to practice at that time. There was just this designation, initially rehabilitative aides. But really what's important is it was considered a specialized medical service. Okay, so it was really something that evolved out of medicine. It was actually meant to be part of medicine. It was meant to be controlled by medicine. And I say this because I actually wrote a graduate paper many years ago in a graduate course I was taking at University of Rochester on the formalization of physical therapy education. And I actually this was before we had online journals, long before. And I was actually in the stacks at U of R looking at records. I particularly looked at meeting notes from the AMA discussing physical therapy as a profession. And it was very clear from that review that they wanted to subjugate physical therapy. They wanted to control it. There was no intention of allowing for any autonomy in the practice. And that struggle is still going on. It's been a long time and it's evolving, but we'll talk a little bit more about that. What I found interesting in preparing for this, because I didn't know this, that the American Physical Therapy Association was founded literally a year before the ACA. So in 1921, and again, you see this movement toward a professionalism. Between the 50s and 60s, we really started to move out of this technical role and more into a professional role, I would say. And then in 1977, the APTA became the accrediting body for physical therapy programs. And so programs had existed up to that point. They were actually accredited by the Council on Medical Education. So this was really the first break with the medical profession. And so, again, this gradual movement toward distinguishing themselves, physical therapists, as professionals. In 1981, and please note too that 1977 was just 3 years after the ACA became the Council of Chiropractic Education became the accrediting body for chiropractic. 1981 also pivotal in that the first state was achieved direct access, and I will make a couple comments about that. All states currently have some form of direct access. Some are pretty restrictive, but all states currently have some form of direct access. There's a lot of battles now toward unlimited direct access. I'm kind of leading the efforts in New York State for that. We have legislation that we're presenting that would take off our current limits, which are that we can treat patients for 30 days or 10 visits, whichever comes first, without a medical referral. And then in the 2000s, another pivotal moment was when the clinical doctorate became the entry-level degree. And again, that happened very rapidly. I have a bachelor's degree in physical therapy. It moved from the bachelor's degree to a master's degree in the 1990s, but then very quickly moved on to the DPT, the Doctor of Physical Therapy degree. I was an educator at the time. We started our program as a master's program, and within 2 years, we were applying for approval through New York State Ed for a doctorate. So that is a really brief historical view of the professions. Education. Okay, well, this could be a really nuanced discussion, and I've decided to kind of skip a little bit more the entry-level process of education, because, and I've taught in both physical therapy and chiropractic programs. For the most part, if you look at overall the organization of the curriculum, both are similar in that you start with foundational sciences, then you move into clinical sciences. Obviously, there are differences in the clinical sciences between the two professions, with a strong emphasis on manual therapies and manipulation and chiropractic education. But that's changing in physical therapy education. All programs now teach manual therapies and thrust technique. And then again, on to clinical education. And the way they're organized are all different. And there's a sprinkling of different topics like ethics and professional issues and business practices. And those are different. Nutrition, for example, in the different professions. But, for the most part, I kind of would see that chiropractic education is a little closer to a medical education in terms of the way it flows. In PT education, it's a little bit more organized around the movement system in particular. So there's more emphasis on any system linked directly to movement, neuromusculoskeletal, cardiopulmonary in particular. Now, here's some differences. There's, to my knowledge, based on what I see, about 20 accredited chiropractic programs in the US. There are over 300 accredited programs in PT programs in the US, with I think about 50 waiting for initial accreditation status. So that number is going to go up. And as a side note, and if we can discuss this a little bit later, there is some concerns on the part of the profession that even though, according to the Department of Labor statistics, both professions see increased demands over the next 10 years. Some are worried that we're producing too many physical therapists at this point. PT education, housed in public, private, a lot of R1 universities house physical therapy programs. Chiropractic programs are primarily in private colleges, but there are some exceptions, and that is going to change. Some of you may be aware that University of Pittsburgh is in the process of developing a chiropractic program. So that'll be a really, I think, a big advancement for the profession to be in a research institute like University of Pittsburgh. I wanted to emphasize a little bit more, though, the post-professional education of both professions. And residency and fellowship programs exist for both. But if we look at their board certifications, that's kind of interesting to me. So these are the American Board of Chiropractic Specialties. The list on the left are those endorsed by the ABCS, and there are additional board certifications on the right. And you're going to see some overlap. So I'll point out where the overlap is with PT, certainly neurology, pediatrics, neuromusculoskeletal, and sports medicine all overlap with specialty certifications and board certifications. So in physical therapy, these are essentially the specialties, and these are all approved by the American Board of Physical Therapy Specialties. So where you see some differences are cardiopulmonary, acute care, geriatrics, oncology, women's health, clinical electrophysiology, and these really reflect the specialties that exist. So there is more variation in practice among physical therapists in that they're in usually one or another one of these specialties, whether or not they are board certified. But what's also interesting is that they're currently developing a specialty in pain management. And I would just further point out that orthopedics represents the largest group of physical therapists, probably no surprise there. All right, David's going to be very proud of me here. I went to ChatGPT to get some information on the culture of the two professions. All right, so this is really a sweep through the stratosphere out there, and in terms of the information stratosphere. And I'm going to spend just a minute reading each one of these. This is what kind of spit out to me. And I found it kind of interesting, and I don't disagree with this. So as far as the culture of chiropractic, it's centered around the belief that the body has the ability to heal itself, and that chiropractors can help facilitate this healing process by adjusting the spine and other joints to restore proper alignment and function. Chiropractors typically view health as a holistic concept, with the physical, emotional, and spiritual aspects of a person's life all playing a role in their overall well-being. Chiropractors also place a strong emphasis on the importance of patient education and empowerment, often taking the time to educate their patients about the underlying causes of their health concerns and providing them with the tools and resources to take an active role in their own care. This includes encouraging adoption of healthy lifestyle habits such as proper nutrition, exercise, and stress management techniques. Now, with physical therapy, the culture of physical therapists revolves around the idea of helping people regain their physical health and function. Physical therapists work with patients to assess, diagnose, and treat physical impairments and disabilities. PT is a profession that values collaboration, communication, and patient-centered care. PTs are dedicated to providing their patients with individualized treatment plans and working with them to achieve their goals. The culture of PT also includes a commitment to ongoing learning and professional development. PTs value the importance of empathy and compassion, understanding that their patients are often experiencing pain and frustration, and they strive to provide a supporting environment to help their patients achieve optimal outcomes. So let all that sink in for a second. I thought that was really, really interesting and very positive, I think, for both professions. So now we're going to approach these questions of where do the two professions diverge and where do they converge? And we're going to look at this through the lens of the PSP role in particular. So in order to do that, I'm just going to review really quickly that whole concept of the PSP, and particularly what is a skill set of the PSP. So how we would define that? The PSP is a specially trained clinician, most often a chiropractor or physical therapist, who practices at the top of their license, playing a primary role in the diagnosis, management, referral, and case coordination of patients with spine-related disorders. And I'm going to credit Don Murphy for this slide because I like the visual here. It kind of gives you a sense of what that means, the full cycle of care. So it's guiding the patient through that full cycle of care, starting, we hope with initial contact or at least early contact in the case of physical therapy. If you look at the treatments, one thing I really want to point out here is all of these treatments, self-treatment, exercise, manipulation, manual therapy, patient education, those are within the toolboxes of both professions, very importantly. And then, and again, it may involve some follow-up at later points in time. In terms of the case coordination piece, what we like to say in a sizable minority where consultative services may be needed, the PSP also has to recognize when those needs occur and where to send the patient, and most importantly, to communicate and to, again, coordinate that care. So that's really important. And then as far as the skill set, so the skill set of the PSP, and again, these will be important when we move on to the next portion of this, is to really look at where both professions converge and where they diverge. One is differential diagnosis. So you have to be able to, you have to have skills in diagnostic triage. I will comment here too that when the entry-level degree for physical therapists moved from the master's to the doctorate, this was the area that was most enhanced in the education, was medical screening, differential diagnosis, imaging, and so forth. You also have to be able to manage the majority of patients with spine-related disorders. That's really that's the value, okay, of the PSP. Obviously, a strong foundational knowledge in pain science and pain mechanisms, which both professions need to have. The importance of screening and managing psychological factors related to spine-related disorders. That's not to become a psychologist, but to just recognize that psychological factors are very common with any type of musculoskeletal problem, not the least of which would be spine problems. And how to manage those, how to address those with patients. Knowledge of rehabilitation, interventional treatment, and surgical procedures. So some knowledge of all of the types of interventions that are out there. Again, in the case, particularly for patients that may need to have interdisciplinary care. Promoting self-care is really important. That's another important role of the PSP, because the more we can teach patients to take care of themselves, the less stress there will be on the healthcare system. Understanding unique challenges of the workers' comp and motor vehicle accident-related spine conditions. And again, coordinating care when referral is warranted, and following the patients in the long term. All right, so we're coming back to this. Where do the two professions diverge and where do they converge? And this is where I hope the discussion will go. And I'll just I'm just putting out what my view is on this. So these are my personal views based, again, on the information that I have and my own experiences. So where the two professions are different, I think certainly their impetus for the development. I mean, they were developed out of very different needs in society, I think, at the time. And really, I would point this out that, chiropractic has been considered an alternative medical practice versus physical therapy that was always considered an allied health profession. Now, I will just make a comment here that we are no longer an allied health profession, even though you will see us identified as allied health professionals now that we're at a doctorate level. The length of time as a doctoring profession, I think, as chiropractors, we've been doctoring profession really since the onset. And so the focus on the whole health of the individual has been more of a comfort zone, I think, for us as chiropractors, as opposed to physical therapists who really kind of were, started out as a specialized service, a rehabilitative service in the health profession. We saw that specialization varies between the two professions. That's probably going to remain the case. And I didn't really talk much about practice settings, but we certainly know that most chiropractors are in private practice settings. A few work in hospital systems, and we obviously the PSP role, we hope to see that grow. And physical therapists, we have a lot of physical therapists working in hospital settings, fewer in private practice settings, but there are numerous other settings, school systems, skilled nursing, for example, pediatric offices. There's a lot of, they're specializing in women's health and so forth. And then scope of practice is obviously, that's something we really didn't touch upon. That would be a whole other presentation. But I think most significant for the PSP role within that is imaging ordering authority. That's a big difference between the two professions. Physical therapists have typically not had imaging ordering authority. I will say that that is a major goal for the profession, is to go state by state and see that change. We have some efforts early in New York on that, but there are currently, I think, 7 states that have some level of imaging authority. Some are just, confined to conventional radiographs. But that I think is an important, to me anyway, that's my personal opinion, that would be a skill or a licensing practice, scope of practice that would be important. Now, I think I really want to focus more on where these two professions converge. And I think we will find that there's a lot more that unifies the two professions than separates them. Certainly the expertise in the neuromusculoskeletal system, that's very strong on both sides. And you can see that in the educational preparation. You can see that also in specialization. We, together are the non-surgical, non-pharmacologic providers. Okay. And as we see clinical guidelines for back pain, strongly emphasizing this piece as first line care, that's really important. That's where a lot of the value comes in. Both professions, I think, more naturally practice within the biopsychosocial model. And of course, we know that there are individual clinicians that may not be true for, but for the most part, you see both professions embracing that. We've already talked about the overlap with interventions. I always like to think that if you had a skilled PSP that was a chiropractor and a skilled PSP that was a physical therapist, you might not see any difference in how they examine the patient, what their diagnostic process is, what their interventions are, and how they manage the patient. Both professions really, again, embrace this idea of the therapeutic alliance. We both spend more time, generally speaking, with our patients than allopathic providers, and the importance of patient engagement and embracing that as well, and wellness principles. But I think really where the two professions come together most strongly, okay, is the societal need for a primary spine practitioner to really address the many issues, cost efficiency wise, and just, despite our attention to spine, the disability numbers and so forth that exist in society that are all related to what, many of us see as mismanagement of spine related disorders, and the need to kind of simplify things a little bit more and get down to the basics. So I think that that's really most importantly where the two professions converge. So we're going to go back to that question, physical therapist versus chiropractor, who is better suited to serve the role of primary spine practitioners? And again, I think, we can look at this through the lens of both strengths and barriers. So with that, I'm going to stop sharing my screen and we're going to get on to hopefully some discussion. All right.
Thank you, Marcia. That's great. I'm dropping a question in the chat from Dan. You can review that and everyone else can review that while we wait. I'm going to proceed quickly just with an overview of the PSPN for those on the call, just so you can get an idea as to what this is. So very briefly, this will just be a couple of minutes, and then we'll proceed immediately to Q&A. I am going to ask the panelists, those of you who are on the call as panelists, paying members of the PSPN, we want to invite you to participate live with Marcia. So when the time comes, just unmute your mic and raise your hand on Zoom, and we'll grab your questions and directly interact that way. So very briefly, the PSPN, it's a membership community platform that enables primary spine practitioners, so chiropractors and physical therapists, as just described, to have the tools and resources to advance your skills, reputation, and career. And so we have a whole bunch of resources available on the platform to accomplish that end. Some of the features include a 3-hour online spine pathway workshop, which we just heard from one of our members, is a very good, succinct summary of the UPIT certification program. Then we've also got these monthly sessions, which really kind of are going to fall within a broad category of group coaching / virtual grand rounds. So there's going to be various kinds of content coming through these sessions. We'll have experts. Next month, we have a PCP who's going to be addressing some pressing matters. We've also got supplemental mini workshops and various practice tools that you can use, both administrative tools as well as clinical and diagnostic tools. There's a screenshot of the pathway workshop. Some grand rounds, as I mentioned. We invite participation in these. And then some of the benefits is we do donate $1 from each membership fee to the World Spine Care, which is an organization dedicated to providing conservative spine care in underserved communities. Membership cost is $8 a month. So for the price of a coffee, join us. We want to see your skills, reputation, and career advanced, and there's no contracts, cancel anytime. You can access on that link. I'll drop that in the chat. Great. So with that, over to Marcia to address that first question.
All right. So Dan asks a question, and I'll read it for those who can't see it. So some chiropractors believe that they own, this is from Dan, some chiropractors believe that they own the adjustment as a core component of primary spine care, even though there is conflicting scientific evidence surrounding its effectiveness. How can we address this perception of ownership and foster better understanding between the chiropractic and physical therapy professions to ensure that patients receive the most evidence-based and effective treatments? All right, that's a great question. It's multifaceted. So let me start with the first part of that about, owning the adjustment. One of the things that I'm very pleased to see, because, back, I think it's safe to say maybe back in the 1990s, 1980s, there were a lot of state-by-state battles about, even scope of practice related to manipulation. And I'm very pleased to say that those battles have pretty much ended. And I think, again, with the inclusion of manipulation in physical therapy education, and believe me, physical therapists, educators recognize that that was a problem early on. And so now they've really done a lot to standardize the educational component. I think that it's again, what we see is that skill set belongs in both professions. And then the second part of that is, how do we address the perception of ownership and foster better understanding between the chiropractic and physical therapy professions? So what we really want to know is, or what we really want to do is provide evidence-based treatment for spine-related conditions. And again, I would just go back to just a statement of fact that most of the tools that both professions have in their toolbox there's overlapping tools, and all the critical tools are there for spine care. So I see the primary spine practitioner role as sort of answering that question, because it is about what's most effective. And then as far as, the conflicting evidence about manipulation, that's why, the classification is really important, so that you're, using good clinical reasoning in determining and choosing which tool to use. Not every patient benefits from manipulation. So again, that's why you have you have a spectrum of interventions that you apply to the individual patient. So I hope I answered that question, to your satisfaction.
Great answer, Marcia. I would just want to briefly follow up, and I would invite our panelists at any point, feel free to unmute yourselves and drop any comments or questions. We invite anything. A quick follow-up, because I'm a DC by trade, when we were having our final send-off ceremony at the University of Johannesburg Clinic, one of the speakers, he was bemoaning the fact that the adjustment has been co-opted by physical therapy, and he was kind of one of the traditionalists, and he said, well, what can we do? The only thing we can do is just get greater and greater specificity on our adjustments. And now down the line, I realize, no, that's not necessary, because it's one tool in a whole toolbox that you apply where relevant to the particular case as demands. So I think that kind of speaks to what you just mentioned, right?
Yes. And I will follow up with also a comment. I happened to get an email this morning in my role as public policy chair in New York that Aetna wants to allow, they want to pay for physical therapy intervention when chiropractors refer to physical therapists. And I did want to address that a little bit, because this is, even though I think both are very, very well suited to serve as the role, that does not mean that the two can't work together collaboratively. Okay. In the practice that I used to own, my daughter owns the practice now. We did a lot of that. We worked with a lot of local chiropractors, and if we really felt like a patient just really needed to have someone who had the strong expertise in manipulation, we would refer to the chiropractor. If they felt that their patients could really benefit from maybe a more in-depth exposure to rehabilitation, they would refer to us. And so that has worked very well, and I think works well in other communities.
Great. We have an excellent question here from George. So he says, how do you explain what you do practice to a PT versus DCs versus MDs? I ask because everyone has a bias. With your experience in the field and professional education as a DC plus PT, I'd love to learn from you. Thank you.
That's a good question. I will say that for the most part, in terms of my own background, my husband is a chiropractor. We opened up a practice. We offered both services to start with, but especially because of the administrative side of practice, we split the practices. So my practice became a physical therapy practice. His became the chiropractic practice. And that was, again, a reflective of the time. And again, I think I didn't have to explain to my patients, that they knew I was a chiropractor. And in fact, I had a lot of referrals from physicians and neurologists and orthopedic surgeons because they recognized the value of manipulative therapy, but felt a little safer referring a patient to a physical therapist. And I think those lines are all blurring. And I think, again, part of that is because of the movement, I think, of the chiropractic profession more into mainstream healthcare. I think I've seen that anyway. I've seen that as a trajectory. So I'm hoping that you wouldn't have to explain that to patients, and that a good chiropractor, a good physical therapist would actually be providing a lot of the same services. So I'm not sure I answered that quite the way you might want it to be answered, but that, it can be confusing. And I will also just further follow up and say that one of the complaints on the part of the physical therapists is that they don't think the public knows what they do. They do think the chiropractors know what they think, that the chiropractic profession has done an excellent job in defining who they are. And so I think for the most part, it might be the physical therapist having to do a little more explaining in the role. So
we got an excellent challenging question from an anonymous attendee who says, what evidence do you have that a, quote, special network will actually redirect the problem? After practicing for 38 years, I have not seen advanced degrees or certifications in either profession actually influence the problems in persistent symptoms regardless of the location?
So that question about networking is, is very interesting. And, currently I'm just very interested in looking at ways that both professions can gain a little bit more power within the healthcare system. I see that as, did not mention this in terms of the culture piece, but I think we all know that both professions struggle a little bit with that cultural authority piece. So I think a starting point, okay, is that like-minded practitioners start to talk to each other, okay? Maybe at the higher levels, and that's how you can kind of strategize in terms of creating change. Creating change in the healthcare system is really hard, and it's particularly hard for us. So I think, unifying together and at least starting to have these conversations is an important piece. We have yet to see that, unfortunately, both professions have struggled to become part of these accountable care organizations where a lot of the value-based payment modeling has been done. That's been a particular interest of mine as well, looking at potentially value-based care models. But both professions struggle. I will not, I will not deceive anyone into saying that we're not struggling with that. And as a matter of fact, Brian Justice and I just got back from combined sections meeting in San Diego, which is the biggest physical therapy meeting in the States each year. And our panel discussion was entitled "The Value Conundrum." So, we have, and you know what my attitude is, we have to do this. It's not going to happen from above. It's going to happen from the trenches on up. So by forming a common community, by promoting this whole concept and movement of primary spine care, and that's how we get our traction in the healthcare system, and we have to prove our worth.
For those who are on the call, we have a number of international folks. Would you just very briefly explain value-based reimbursement, and then specifically identify how getting certified as a PSP, for instance, with UPIT, or identifying with a network, how that can actually promote the cause of value-based reimbursement, just as a kind of follow-up to identify that matter.
Okay, great question. So again, as I've established, value-based payment is a little more common that you'll see, in the medical profession, because they are all linked to these accountable care organizations. And in physical therapy, for example, okay, CMS, okay, is developing a value-based payment modeling. They are moving their MIPS program to a MIPS value pathway. That's in the works, okay? And that depends on certain metrics and reporting on certain metrics. So CMS is one model, okay? Not necessarily the best model. That's one model. There, you will see bundled payment models in the physical therapy profession, but that's few and far between, and usually for very, very specific conditions that are post-surgical. The other model that I like the best is pay for performance models, which require, some type of metric that both the payer and the provider agree upon, and meeting benchmarks. That model has been successfully implemented. We're looking at that kind of modeling a little bit at Excelis Blue Cross and Blue Shield here in Rochester for both physical therapists and chiropractors. But our professions have both struggled with that. There was a second part of the question about, what kind of, how the certification, of a PSP might move you in that direction. Interestingly, just got an email this morning from a graduate of the PSP program at University of Pittsburgh. And this individual's in Puerto Rico, just got hired by a hospital system in Puerto Rico to realize, okay, this role as a PSP. And so he will by definition be in a value-based care model. So that's how you do it.
Yeah. And so it's essentially hold the course, stick to the evidence-based world, as it were, don't go down tangents. And really that kind of answers the next question, which we got from Goodman, which speaks to the South African context. Goodman is a chiropractor, and he is kind of bemoaning the fact that you can't work in a hospital setting without criticism and bad blood. And there is that dynamic in South Africa. It's further behind on the continuum of integrated care. But really hold the course and stick to evidence-based care, and these pathway methodologies. This is right in line with where the future of healthcare is going, and I think that kind of answers that, right?
Yes, very good summary, David.
We've got another question from James, but for those, out of respect for time, anyone who needs to go, feel free to go. Marcia has agreed very kindly to stay on for another 15 minutes until 1:30 to field some more questions. So if you're interested, continue to stay on. And if you want to go and join the membership, feel free to go to primaryspineprovider.com. You can sign up there. So next question from James. I have seen that board certification of chiropractors as specialists is required by federally qualified health centers. In addition, board certified chiropractic specialists enhance their opportunity with hiring by the VA system. Yet the value of board certification by the systems is in an early stage. VA is Veterans Administration in the United States for our international audience.
Yeah, so and that's true of the physical therapy profession as well. Most board certified physical therapists don't see any difference in terms of, you know, the payment for their services. You know, so that a lot of that is driven by personal interest. But you know, with the VA system, for example, they are really recognizing the importance of this role, and they actually, the VA, to me anyway, has been more progressive than other areas of healthcare. They have really embraced this PSP model. They're encouraging the PSP program for their employees. The other aspect of the VA is that they've embraced this military model of physical therapy, and physical therapists have special privileges within the military. They can order imaging, they can actually prescribe some limited pharmaceuticals, and they tend to serve in primary care roles. But yeah, certification, you know, is just a step. It's just a part of it. It's not, you know, not the vehicle to get necessarily, you know, in a straight direction where you want to go, but it is part of it, and it's enhancing your own education so that you can be better at this role.
Great. We've got another question from an anonymous attendee. In a perfect world, how would you staff a spine center with the sole purpose of primary spine care, and how would it function within the current healthcare system?
Yeah, so that's a good question. So, you know, again, you know, there's the centralized healthcare centers, right? And then there's community centers. So, you know, how you would staff that, I think you know, we've seen models where both chiropractors and physical therapists are serving in that role within the same healthcare system. And they're coordinating services with other disciplines within that healthcare system, but they're being screened initially. All the patients are being screened by the PSP. And then care is only escalated when it's needed. Okay, so it might be to physical medicine, you know, physiatrists, you know, it might be to the orthopedic surgeon, it might be to the neurosurgeon. Much more efficient system, much less costly to the system. So that's where I would see the ideal. And then community providers, you know, that weren't playing this role would also, you know, have, you know, knowledge of these centers that exist so that they would be fed by the community providers. So that's and that model actually is being realized in pockets, okay, in pockets of places throughout the states. A lot of times, though, you will see that, you know, one system, you know, for example, Atrius Health in Massachusetts, they have physical therapists serving in the role. You know, Rush Medical Center in Chicago has a chiropractor serving in that role. So, you know, it just depends on the system.
We've got another question from James. Chiropractic scope of practice does vary from state to state in America. Do DPTs, doctors of physical therapy, have one scope nationwide in America?
No, It's sort of the same situation where the scope varies and can vary considerably from state to state. One area in particular that varies is dry needling, for example. A lot of states allow physical therapists to perform dry needling. Some states restrict it. Unfortunately, New York is one of the states. And one of the things I've learned in public policy, not to get tangential, but boy, is it complicated. I mean, policy is really complicated and every state is different. I mean, if you even look at the way Medicaid is set up in each state, it's so different. And your avenues to impact the system are so different. The licensing boards and where they're housed, relationships that are there, how strong lobbying groups are, all of that it's fascinating.
Great. Well, at this point, it doesn't look like we got any further questions. Thank you, everyone, for your participation. Marcia, thank you so much for your time. That was great. And as always, head over to primaryspineprovider.com, join us for membership. Thank you for your time and attention, and we will see you next month around the same time. We'll alert you once we've pinned down the dates. Have a good day.
All right. Bye-bye.